Welcome everyone to sqadia.com. My name is Osama, and today we are talking about interpretation of diagnostic tests. In this series of lecture, the topic that we're going to cover right now is about the general considerations regarding the interpretation of diagnostic tests and laboratory statistics. So we are going to talk about the positive results, the negative results, and the type 1 and type 2 error in this lecture. So laboratory results can be interpreted as a positive or negative, and these laboratory tests can be used for numerous procedures or numerous reasons. The most important and the most common is the clinical ones, in which we use different type of laboratory tests or laboratory results for different type of diagnosis for different type of patients. But these laboratory results or laboratory tests or values can also be used as an outcome measurement tool in different types of research. So how are these positive and negative interpretations carried out, and how do we decide that if there is or this result or this value gives us a positive result or a negative result? So this is based upon the reference ranges. For example, if we talk about the normal blood glucose level tested while fasting in the individuals who do not have diabetes, so they would have a value of 3.9 to 5.9 millimoles per liter, or 770 to 100 milligram per deciliters in normal individuals during fasting. But if we see that any individual is having, let's suppose, blood glucose level, also commonly known as blood sugar, higher than 100 milligrams per deciliter, for example, or 5.5 millimoles per liter, so it is higher than the reference range, and the person can be said to have a positive laboratory result or positive finding for being hyperglycemic. Similarly, if it is lesser or it is less than the lowest value, which is the 3.9 or 70 milligram per deciliter, then we can say that that person has a positive test for being hypoglycemic, or that specific result was positive for that. But it is also possible that an individual's result comes in the values of the normal reference range, for example, 3.9 to 5.5 millimoles per liter. So it means that that individual's result for that laboratory test or finding was negative. So it means that person does not have that condition, or diabetes or hyperglycemia, etc. So that's how we interpret a positive result and a negative result, as we discussed in the example. But these positive results can be of two types. It can either be a true positive test, or it can be a false positive test. A true positive test, as the name identifies, is a positive test that results for a person with the appropriate disease. So for example, if you were considering the example of hyperglycemia, so if a test comes positive for that person, or that test value was greater than 100 milligrams per deciliter, so it means that that person had a positive test. And if that person really had hyperglycemia, so it means it was a true positive test. But on the other hand, the test which is positive result can also be a false positive test, in which the test is positive for a healthy person who does not have that disease. So it may be possible that a test comes positive for a person who does not even have diabetes or hyperglycemia. Similarly, on the other side, we can also have true negative and false negative test values as well. So a true negative test would be a negative test resulting in a healthy person, which is the right way, or which is the right form of negative test. But sometimes it can also be falsifying on the basis that it can result in a false negative test, in which a person may have the disease, but the test result may come back as negative. So which means that the person was having the disease, but we failed, or the test procedure failed to identify that disease. So that would be known as a false negative test or a false negative result. So let's take a look at the summary of the positive and the negative results of any type of laboratory test. So we have a positive predicted condition or a negative predicted condition. So we can have a true positive in which the person has the disease and the test also identifies him as having the disease. A false positive is that, for example, when a person does not have a disease but the test identifies that person as having that disease. Now that type of error is actually known as a type 1 error. And on the other hand, a person did not have the disease and the test also identified that person as negative, so that would be a true negative. But at the same time, it is also possible that a person has the disease and the test result identifies him as negative, which means that person has the disease but the test failed to identify him as having the disease. So that is known as false negative, or this type of error is known as type 2 error. So these are the different types of results that we can get from different type of laboratory test and outcome measurement test. But we have to keep in mind that these tests can also mislead us if there is actually a type 1 or type 2 error. So in this lecture, we talked about the positive results, the negative results, and the type 1 and type 2 error regarding the general consideration of interpretation of diagnostic tests. I hope you learned a lot out of it, and stay tuned for the next lectures in this series of lecture. Thank you very much, and keep on watching sqadia.com.